is a huge, huge honor today to be podcast interviewing Dr. Pei Kang, who goes by Dr. Pei. You have an unbelievable story. You're a dentist. You're a PhD. You started finding your voice on radio. I want to start off with, now you live in Dallas, Texas. I want you to start off with your whole story. Your story is amazing. Start with where you were born, why, when you became a dentist, where you practice, what's your PhD all about, and then we'll get into finding your voice radio. Tell us your story. It's an amazing story.
Oh, thank you so much for inviting me. And we had a very short pre-chat right before this recording, and I can just tell you have been writing this technology. I'm very impressed that you know this podcasting thing that you just took on and you grew your listenership. You're serving your audience. Thank you for what you do.
Well, thank you.
Yeah, so where I was born in China, and
whereabouts?
So not far from Beijing.
Okay, northern China, where they have winters and snow.
Oh my goodness! So it's if you look at the climate, it's similar to Boston, and so I'm in Texas now, and the summer is real tough for me. Yeah, the winter is very nice. So I actually originally studied dentistry back there, and I practiced a little bit where I was mainly in emergency room and taking care of root canal after root canals. And at the time, it was very labor intensive. It was government-owned hospitals setting, and that was where basically after graduation from dental school, that's where you go to. And that's actually considered a good job. And it wasn't because it's partly because it was somewhat boring, and it's not very well paid. But the other side is my mom. She went did some fellowship in Japan, and she always thought, why don't you go to another country to study something else? And many of you possibly know, being any Asian parents, they pay attention to your academic work a lot. Or they try to get you study, music and, play violin. And that wasn't me, but academically,
it reminds me of the funniest scene. Have you ever heard of the movie, the cartoon Family Guy?
Oh yeah.
And the little Chinese kid is only like 10 years old, and the dad runs in the room and says, "How come you're not doctor yet?" He goes, "Dad, I'm only 9." And he goes, "Oh," and then he slams the door and leaves. I thought it was so funny.
Oh, that sums it all, doesn't it? Yeah. So, my mom, dad, they both went to college, and my dad thought, "Oh my gosh, if you can get this PhD from America, wouldn't that be great?" I had no concept what any of that meant. Even when I was in my 20s, you would think after you got some college education, your life direction. Not really. I kind of just like, okay, I'll try it. So long story short, it actually wasn't that easy. I got accepted by school, but I didn't get visa until the third try. And I almost went to Japan. And the last try, they said, "Hey, you get to go." So I packed up and came over to Texas when I was 25.
And what would be looking back now, what would have been the advantage or disadvantage of your mother going to school in Japan versus you going to school in Texas, United States, and getting your PhD? Or looking back, you wish you would have gone to Japan, or does your mother wish you would have came to America? What's the pros and cons of the decision of going to Japan or United States out of China?
That is such a good question. My mom she's a cardiologist, so she went to Japan, study nutrition. She went to Japan to do the fellowship, but find out, the root cause of lots of heart disease is actually, nutrition and diet. So she was very intrigued by how in Japan, how sophisticated the programs run. So she studied that. So actually, to be honest with you, her going to Japan possibly didn't really have a whole lot to do with me coming to America. However, I grew up extremely poor. I mean, I still remember the days we shared the apartment we had. It was just one room, bedroom, kitchen. I mean, the kitchen was outside, but not outside, but kitchen is outside our little room, but a bedroom and dining room, everything. You just got one room of 4 people. And so when China was changing, that's when my mom went to Japan, and she got some scholarship, and she actually saved out the money for me to able to buy the plane ticket and pay some money to come here. So if I didn't come to the U.S., I would have gone to Japan for sure, because I already got everything set up for that direction. I guess it's destiny, honestly. Life would have been great either way, but wherever I land, I do the best I can.
Now, if you would have gone to Japan, you would have learned Japanese. In Beijing, do more Chinese people know English or Japanese or Korean? Would it be
Definitely English.
definitely English?
Definitely.
And how many dentists do you think are in China? And of those, what percent can read English? What percent can listen and understand English? And what percent could speak English?
Super good question. So 100% can read. Speaking is obviously any language. The speaking is possibly the hardest, because ever since I think we started study English when we're about 12 years old. So by the time you take the college exam, English is a big part of it. So reading English and English literature is not very difficult, but speaking actually to really communicate, or their listening, if they listen to us speaking, I'm not sure they can actually understand very well. And speaking obviously is just the next layer, even more difficult.
I always found it interesting with my friends. America is a huge immigration country. I mean, a lot of
Yes.
you go to Poland, they're all Polish. You go to Korea, they're all Korean. You go to Japan, they're all Japanese. But if you go to the United States or Canada or England, it's
It's
just
a melting pot.
It's a melting pot. Would you say those are the only 3 great melting pots? The United Kingdom, the United States, Canada. I mean, to this level.
Well, to my understanding, America is the biggest, because the whole country, the concept is built on immigration.
But I have so many friends whose parents came from another country, and I find it interesting how they can understand their grandmother totally, but they can't speak it back to her. So it tells me that that's got to be 2 different parts of the brain. Because I'm thinking, an American only knows one language. You always know you're an American if you only know one language. And to be able to understand, to me, it seems like, well, if you understand her, why can't you say it back? But they say, I can't. So
Right.
it's got to be 2 separate areas of the brain. So you came to Texas at 25, and what school did you go to, and what was your PhD in?
Well, so originally I applied for the academic side of dentistry, study molecular biology related to the cause of cleft palate. So it's not really dentistry, but it's kind of, we can name it oral biology. And that's in Baylor College of Dentistry. Now is actually part of Texas A&M. So
Is Texas A&M in College City?
It's in College Station.
College Station. I'm sorry, College Station, Texas College
Yeah.
Station. Okay.
It's all the same, right?
Okay, I was close. I had the college in there. College Station. So you studied. How long did it take you to get your PhD?
Is a total 4 years. So
Wow.
at the end of the second, or I think at the end of the second year, my mentor, who's I have to give her credit for just a lot of things I where I am today. She really pushed me to make a decision. What do you want to do? Do you want to stay in academic, become a professor, or do you want to gain some clinical experience? And, I was possibly 26, 27 then. I was like, gosh, I really just don't know what I'm going to do with my life. And then one day I thought, I didn't enjoy doing all this root canal work, but I was good at it. So I thought, hey, and obviously I was attracted to the financial, the ownership, the potential ownership of business in the future. So I thought, let me try to see if I can study endodontics. So my last year in my PhD was combined with my first year in the endodontic program, which that total 3 years. So total, I did my 6-year combining PhD and my specialty training.
So you're an endodontist with a PhD in oral biology.
Right. That's correct.
You're probably the smartest person I've ever met.
See, those letters make you think I have more brain cells, right?
I think you do. I think you do for 2 reasons. You probably have more brain cells, and I probably killed a lot of them over the years drinking too many beers. So, because if your mother was a cardiologist who got a PhD in Japan on nutrition, you probably ate healthy. But I wish your mother was here because I wanted to ask her, with a PhD in nutrition, what type of potato chips does she recommend the most?
None.
Lay's, Doritos. What would be her expert opinion on picking your perfect potato chip?
Well, she possibly gonna look at your overall, evaluate your blood and see where you are at your health. Oh, I'm kidding too.
I gotta tell you my side out. Tell your mother this. I was 50 years old, and for 4 years, my doctor kept telling me, look, your blood pressure is 140 over 90. I got to put you on high blood pressure pills. Your cholesterol is off the cliffs. I need to put you on a statin. And I kept saying, no, I know it's bad because I don't exercise and I eat bad. So finally, when I turned 50 and I realized my dad and both grandfathers all died at 60, I've signed up for Ironman, a triathlon where every morning you bike, swim, or run. So, you bike, the next day swim, next day run.
Wow.
And at the end of the year, I went back to my physical, and my doctor said, if I would have put you on a statin, I couldn't have lowered your cholesterol this much. And if I would have put you on high blood pressure, I couldn't have lowered it this much. And if all I saw was your numbers, your blood pressure, all the tests I ran, if all I saw was your numbers, I think you were a 20-year-old marathon runner.
Wow. So
that was, I'm still short, fat, dumb, and bald, but at least my blood pressure, cholesterol, and all my numbers look good. So nutrition is key. And Americans, when I go to China, I've been there several times, and I mean, Asians and Chinese in general probably have the healthiest diet in the world and Americans probably have the worst. Would you agree with that?
Yeah, yes. I do have a concern these days. China's becoming a very wealthy country these days. And when I go back, I do unfortunately have seen people start to increase their portion significantly compared to before. So, the level of poverty we were in compared to what is now, I wish people could realize just because we have so much more resources doesn't mean we ought to indulge in those.
Absolutely. And I also met the first pediatric dentist in Hong Kong. And I met the first pediatric dentist in Kathmandu, Nepal. I met the first pediatric dentist in New Delhi, India. And they were all telling me the same thing, that as the diet became more Western, I had this dentist in Nepal telling me that when he practiced from age 25 to 50, he never saw a child under 6 have a cavity. And then Coca-Cola and Pepsi rolled in along with Snickers and McDonald's and Wendy's and KFC and all this stuff like that. And he said, now it's pretty much a general that you tell me the age of the child, that's how many cavities they have.
Oh, wow. Well, here's a funny story. You were talking about, what my mom would recommend about potato chips, but one of her favorite, I guess she possibly her favorite cheat food is McDonald's French fries.
Oh yeah, that's just they don't serve food better than that in heaven. That's got to be the ultimate. But unbelievable. But you know what's interesting though is when you're
Mm,
studying stocks. A lot of these stocks are growing in sales, but you when it's a franchise, you got to look at same store sales because their sales might be increasing because they're opening a lot of new stores. Like in China, they're opening up
sure.
McDonald's and KFCs as fast as they can, but same store sales in McDonald's has peaked and is going down because
Mm,
now highly educated mothers aren't taking their kids to McDonald's. So McDonald's,
good.
for the first time ever, is going to have to sit there and say, look, you're not going to get a college graduate mom to take her two kids to McDonald's. I think they're going to finally have to. And what was the response? Oh, we're going to offer breakfast all day. I mean, they still don't get it. They still don't get it that people like you and people like me, I got a 3-year-old granddaughter. I'm not taking her to McDonald's.
Hmm.
I go there myself after I put her to bed.
And
So,
I see you looking around, make sure nobody's hearing you that.
no, Ryan's right here next to me. So then, how long did you practice endo, and what could you share about? I wanted to capitalize on your degree in oral biology and microbiology because dentists are always trying to obturate this root canal tooth so it looks beautiful on an X-ray. And the when you talk to smart people like you, root canals is about what you take the infection out of the tooth,
So true.
not what you fill it up with. And all the dentists want to say, well, do you use lateral condensation? Do you use vertical condensation? Do you use a hot gutta percha glue gun? Do you use thermophil? What sealer do you use? It's like, dude, every question you ask has nothing to do with endo. Endo is about the endo is about getting rid of the infection. So you're a PhD in molecular biology, oral biology, and you're an endodontist. What tips could you give us on root canal therapy, root canal success?
Oh my gosh. You're so right about what you said. What's more important is taking it out. But there are so many tips I can share. I can just start with a couple.
No, give
Uh,
us all you got. You're the last. You're the only thing I got. After you, I have nothing. So you just go. I'll sit here and listen to you till midnight if you got that many things to say. But because endo, seriously, when I talk to my homies and say, what stresses you out in dentistry, they say molar endo. Gosh, I got to do it because they're in pain, they're suffering. It's $1,000. You make a lot of money, but god dang,
okay.
it's just hard. It just
Let,
beats the
let's
crap out of
start.
me.
Let's start there. Let's start with somebody with pain coming to you. One of the very first important thing is when they are in severe pain, occasionally you can tell exactly what's going on. It's very obvious. The patient knows you know, but sometimes it's not. And no matter how much pain patient in, I always take my time because sometimes when they are in so severe pain, it's hard to distinguish. Sometimes even it's upper or lower. So and sometimes taking an X-ray could be misleading because when we see a big lesion, we're like, sure, that's got to be it. But I always listen to patients. So, for example, if somebody say, "Oh my gosh, this tooth's been extremely sensitive to cold. I can't have anything, even cool air, make it hurt." But if that's the case, and then you see a lesion on the X-ray, or if you see an old root canal gone bad, that's not the answer. There is a tooth that's sensitive to cold that you have to find out that's the tooth. So the first step, the diagnosis is very key. And the second thing is we're here to fix problems, and patients expect us to do that. And to get them out of pain is obviously awesome for them, and it's good for you, for us as dentists. However, not every tooth is best for us to start drilling, and you think draining it out is going to get them out of pain. So after you clearly identify which tooth it is, the tooth that has lots of temperature sensitivity, those are the teeth that if you able to get them, get it open, release the get it open to the pulp, they get the most relief. But the necrotic nerve or the old root canal gone bad, those teeth sometimes, if you opened up on that same day, you could actually cause more pain. And obviously, if you communicate that, then that's good. If a tooth that doesn't feel any cold at all, then and then you say, I can definitely open this tooth, but I need to put you on antibiotics. But I do want you to know, after I open it tonight and tomorrow, it's going to be very sore. And you might actually have a little bit swelling, but you will also get some antibiotics. So manage the expectation is very important. If it's a tooth that's very cold sensitive, that's the classic, irreversible pulpitis. Those teeth, the very important number one thing is you got to be sure the patient is numb. So I, after numbing, especially lower jaw, even upper, I do this, but especially lower, I gave them at least 10 minutes. I gave them even an Advil to take before I numb them to help reduce the inflammation. And then after 10, 15 minutes, I use a very extremely cold ice to test and say, hey, it's that spray endo ice to say, hey, do you feel anything? And if they say no, I test it again, because I don't want, any of my patients say, I felt what you drilled. And, that's just it. Any of those little steps will lead to favorable results. And this, I'm not even talking about obturation yet.
So help out this kid. They're 25 years old. They just walked out of dental school. And one of the big stressful things they have is not knowing which tooth it is.
Yeah.
What do you do? What do you do when you're not sure which tooth it is?
Okay. Well, obviously, I'm not going to say refer to an endodontist, but because that would be an easy answer. So the start with is there's a whole list that you filter through. Some questions, asking their history is very key. And most of the time, you can ask them, where did they start with? And they say, oh, it's down here. But then later on, it feels like everywhere. So more likely it's where it starts with. So you can start with there. And obviously, X-ray will aid with the diagnosis. And then, so the sequence of story, and then the thermal test, percussion test. And here's something interesting. The percussion test, sometimes we can have a tooth that's definitely needs endo, but the tooth next to it actually feels more percussion sensitivity. So you got to be careful with that. And so when patient come back, if you did drill on the wrong tooth, obviously that's something that is very hard to explain afterwards.
Oh, it's easy. You just say, wow, that infection was so big it spread to the other tooth. Unbelievable. Not that I've ever said that once.
Another tough diagnosis is the molar, especially second molar fractures. Their symptoms can be very minor or very make you think it's actually second molar, but make you think it's the first molar, but it's actually the second molar.
And a lot of these kids get stressed out. They post pictures on Dental Town. They say, what do I do? The tooth died. They took off the MOD amalgam. They found the canals. They're cleaning it out. And then they see a black crack along the bottom.
Yes.
What should a dentist be thinking when they see a black crack on the bottom? Do you treat? Is that when you say this is just going to be a temporary thing and I should really be extracting this and doing an implant? Talk about cracks and what they mean
Oh
to
my
you.
gosh, that's my favorite topic. If I seen this so often, just about every week or sometimes every day I see one. Every week, at least 2, 3. And mostly it's associated with lower second molars and mostly associated with people with a little bit bruxism, older than 40, or people with a little bit chronic stress. And when there, the reason why sometimes it's not obvious, in the beginning stage, they always complain, say, hey, doc, when I chew on certain things, it hurts, but not everything. But that's the beginning stage. If you can catch that symptom and identify that's a very bad tooth, even if there's no filling on that lower molar, if patient, a good test is that called tooth loose test, and if you have that called a pain on release. So when they bite down, they feel okay, but when they release on a particular cusp and they feel jolt, may or may not be severe. And those teeth in the beginning, they don't even feel much severe lingering to cold at all. But if at that stage, some of the teeth can do very well with a crown, especially a gold crown. That's my observation, not the clinical data. It's just overall, I've seen people do better with gold crown. And then
Why do you think that is? I mean, I agree with you. I'm 53. I have seven restorations, and they're all gold onlay crowns.
Yeah.
Because when I in Phoenix, Arizona, there's a lot of retired people. I have a lot of patients that are 80, 90, some of them 100 years old. And the only dentistry I've ever seen that lasted 50, 60, 70 years and looked awesome was gold. I never saw any other material last like that. So that's the only thing in my mouth. But why do you think the gold works better?
Well, you possibly have more insights or intuition on that than me. My suspicion is less tooth preparation.
Okay.
What's your thought?
Yeah, I agree. A lot of these people are reducing 2-3 millimeters. They have to reduce. It's kind of weird when you have to reduce and drill down a lot of teeth to restore it. That doesn't even make sense. What are you doing? Oh, I'm drilling down your tooth to restore it. Whereas an inlay and onlay, you take out all the defect and cover the cusp, and then go with the gold.
Yeah. Yeah. So one tip I do recommend, if you end up doing, even if in the early stage, if you can catch it, I think that's a blessing for your patient, because if you over the years the crack increases, then they eventually do end up losing their teeth. And if I'll go there in a moment. So, but if you do crowns on those teeth, even if it's a gold crown, again, manage expectations. Always tell them, guess what? You don't have any decay. You don't even, and this tooth is fairly sound. However, any cracked teeth after a crown, it has a chance that it needs a root canal. So let's wait and see. Hopefully we found it early. So you always communicate with patient on that. And once that, hopefully, that's the end of that. But when I see a patient with lower second molar with very minimum restoration and they need endo, I always say, you know what, I think this tooth is cracked. I'm just 95% sure about this. We're going to have to find out once we get in there if it's worth your time and money to try to do a root canal or not. And if the tooth still has vital nerve, most of the time that means the crack hasn't gone deep. But if the tooth already necrotic, you see the lesion wrap around the root, I would say the survival chance is very low.
So at that point, you'd extract.
To that point, I do communicate one more time with patients that I don't think this got a good chance. Do you want me to open it to take a look, or you just want to take my word for it. I do give them that choice, and most people understand. It's possibly time to cut the loss.
And I think that's so amazing for you because most people would think, well, you just want to do the root canal because you're going to get paid $1,000. And I think dentistry is so noble in the fact that here you are turning down $1,000 and saying, no, it's not worth your $1,000. Don't give me your money. I mean, I look at all the gazillions of hours me and my friends spent trying to get fluoridation into Phoenix water and being called communist and crazies and I spent more than 1,000 hours trying to get fluoride in the water in '89. I mean, I didn't work Fridays for 2 years just answering all the crap from the 8th city councilman, the mayor, and getting hate mail. And because 25% of Americans just absolutely hate any form of government. They don't want the government touching their water. They don't want the government putting fluoride. It's just an anti-government thing. I mean, this country has the most anti-government people I've ever met in any other country. Like you go to Scandinavia or Australia, everybody wants to work together. You come to America, and it's like 25% of the people want to overthrow the government. You know what I mean? Like you're in Texas. There's more guns than people in Texas. So I just think it's neat that dentists are trying to prevent decay with water fluoridation. They're always trying to prevent decay by putting you in the hygiene department. They're always telling you to brush and floss. And here you are saying, no, I don't want your $1,000. It's not worth your time or money. Cut your losses. Dentistry is a very noble profession.
I believe so. I think it's all about. I think what I see these days is if a dentist gets so much student loan to finish dental school and then build up a really nice another couple $100,000 to get a brand new building, that dollar sign is going to start to cloud your judgment. And to me, it doesn't matter what profession. If this is my tooth or this is my mom's tooth, there's just no chance that you will want anybody else to do that kind of if honestly, let's put it this way: if the goal is to make money, honestly, don't select dentistry or being a doctor at all. There's so many ways of making great money. That's much more than being a doctor.
Well, and what ways would that be?
Oh gosh, owning a franchise. Let's say Supercut. I mean, those are franchise ideas. And honestly, in Texas, especially the town I practice, I had the opportunity to meet so many private business owners, and they either have like a business of 5 people or 10 people or up to 50, and they have more time freedom and money to dispense than a doctor. I mean, it's not an easy profession. We dare a lot. We only make money when we work on patient. And we don't, honestly, you say we have a business, we really don't. We own our job. Unless, because other business owners, they actually leverage other people's time to make additional income. And they do have more time freedom.
So you say dentists own their job, whereas a businessman owns other people's time?
Well, I wouldn't say own, but still they can leverage other people's time to.
Well, I never understood, people badmouth corporate dentistry like Heartland, Rick Workman with Heartland or Steve Thorne with Pacific Dental Services and hiring up all these kids and opening up all these franchises. But I look at 5,000 graduating dentists every year. I look at 150,000 physical dental office buildings. I know because I mail a magazine to them all each month. And out of 168 hours a week, that building's open 32 hours. So you take 132 hours into 168 is 19% utilization of the land, building, equipment, everything. So that facility's sitting there empty 4 out of 5 hours. and they have no idea how many incoming calls are coming of some nice lady, Dr. Pei, saying, help, I have a toothache. I need a root canal. I'll give you $1,000 to fix it. They don't even track the incoming calls. All they have is an answering machine where 13 incoming calls come before one leaves a message. And I think that dentists just aren't good business people. The only good business people I see in dentistry is if they weren't born in the United States. Oh, I had talked about that since you were born in the United States. When you talk to the consultants, we all say, there's some things you say you can't say because they're just politically incorrect. And I never learned what those were. That's what my seminar is called, Dentistry Uncensored. I've actually been we won't even go there. But the bottom line is every consultant will tell you that if the dentist was born outside of the United States, especially from anywhere in Asia, they live frugal during school. When they come out, they'll buy a practice. They'll usually live in the practice. Their hours will be 7 to 7 days a week for the first 5 years. And you come back 4 years later, they're out of debt and they have a ton of cash. But if it's an American, born in America, they come out of school, they'll buy a house that's the same size as their practice. They'll go buy a $30,000 car. They'll go out to eat dinner almost every single night. They'll take vacations and cruises. And you come back to those people at 50 years old and they're still in debt paying interest on other people's money. But they go, not the Asians. The Asians will work twice as hard and will not live frugally. We'll live frugally and will be debt-free 5 years out of graduation. Agree with that or disagree?
Well, I can only speak for myself, but I didn't know that. Is it really true?
Oh, it's very true. In fact, when I go into dental schools, in fact, I even lectured to a dental school this morning. I did a podcast lecture to Nova Dental School, and my standard speech at every dental school is I tell those guys, I said, the smartest decision you can make is before you graduate from dental school, you got to marry one of the Asian chicks in the class. I said, she's going to make 150, 200,000 a year. I said, you won't even have to work. You'll just be her little pretty boy. She'll just work. And you know what they're going to do? They're going to be a dentist, and then they're going to build a building, and they're going to buy all this equipment, but they're also going to marry a woman who has no intention of working, and she's going to spend $10,000 a month, which is basically $100,000 a year, and over a 40-year marriage will destroy $4 million of revenue. And that's the bigger source of stress in their life than getting dental student loans. They always, 7 out of 10 of them, marry a woman who will never earn a dollar. And not only will never earn a dollar, she's not going to stay home and cook dinner. She's not going to have 2 kids. She'll have 4. She's not going to buy a 2,000 square foot home. It'll be a 5,000 square foot home. She's not going to buy a Chevy. She's going to buy a BMW. And she's not going to paint her own nails. She's going to get a mani-pedi. It's just crazy. And then by the time they finally pull the plug on this cash destroying machine, then the divorce will cost them $1 million. Oh. So I think you can get rid of all your stress by marrying a Chinese dentist like you. Do you have an identical twin that I can marry? A twin sister, anything?
Well, I have a sister. She's a breast cancer surgeon. But, part of it, I don't know. My mom, she's actually quite a spender. Your
mom is a spender? The cardiologist?
Even when we didn't have money. But
the key to reducing stress is quit spending so damn much money. You got a week off. Why can't you go camping and fishing at the lake? Why do you have to take a cruise? You got a week off. Why did you have to go to Paris, France? Why couldn't you have gone to Baylor? Why couldn't you have why do they have to spend money? You meet dentists and you look at their lifestyle, and my first question is, dude, are you like a famous rock star? Did you sell 1 million albums of something I didn't hear about? It's just crazy. And if you marry a crazy spending person, you're going to have a life of stress.
Yeah, I think when you look at a lot of dentists, they feel like, oh, I'm going to make so much money, and they spend on potential future money. And that's just not the way to do it. And when I bought the practice, that's after 2 years of working for in a associate position, I actually, I bought a very small practice and it was, the equipment, everything's very old. I did not spend any money on replacing the furnishing. I hate looking at them, but I didn't spend any, and until I had very positive cash flow. And honestly, I actually painted the walls myself, repainted the walls myself. And guess how long? The loan was for 7 years. I paid it off in 4.
And but most of the people listening to us right now, 95% are listening to us sound only on iTunes. Only 5% are seeing the video on Dental Town or YouTube. But to you guys listening on iTunes, if you could be seeing this, when she looked at me, she made me put a paper bag over my head. She goes, "You look worse than my old dental equipment." And so you guys can. I'm talking through a bag right now. So yeah, I just think the anti spending advice is just so point on. I mean, it's just I look at all the dentist problems I know, and a lot of that even got into substance abuse. One of the reasons they got into substance abuse because they were in a marriage where the problem that was causing all the problem was their spending, and the overhead of the office, the spending going on at home, and they finally drove themselves to drink or eat Vicodin
Oh,
or do drugs or whatever. So they just got to slow down the spending and they need to work more hours. And I personally think if you own your own home and you rent your own office, you kind of were born in a barn. I mean, you're not much smarter than a cow or a sheep. Yeah, I mean, you probably go home and visit your dad and say, "Dad, Dad," because only a sheep would live in a building bigger than their business. I mean, it just makes no sense for me. So you own your land and building of your dental office while you live under a bridge in a cardboard box, and you learn how to cook at home, and you don't spend money until you have it. And then what you're going to find out is when you have more money than you'd ever know what to do with, then you don't even want to spend it because you never
yeah.
developed a life of habits where you always got to spend money to be happy. I want to focus one more thing on endo because I can't let you go with a PhD in molecular biology. Dentists always ask me, well, after a root canal, what antibiotics do you give them? Do you give them, and then they have long discussions. Do you give them penicillin or augmentin? Or do you give them penicillin and metronidazole? They're always talking about about antibiotics. Do you
Okay.
think antibiotics is a big part of endodontic success, or do you think they're overprescribed?
I don't think a lot of times I don't think antibiotics it really plays a part in the success. However, and honestly, this might be very controversial, and the textbook possibly is not going to agree with it. But in my practice and in the doctors I work with, we have seen a significant less pain with patients that took antibiotics. And so another distinct, how I judge who I should give, I normally look at if the patient doesn't have much lesion and the tooth is still very sensitive to cold and hot, especially cold. If it's sensitive to heat, that's there are two reasons they could be sensitive to heat. One is the infection is getting worse. Two is the tooth actually has possibly has a crack. So if the tooth is just sensitive to cold, I possibly wouldn't even worry about getting them the antibiotics. But there has also been in the past when I did, for example, if the patient calls on Friday and I'm not there, and so the general dentist end up prescribing some just mild amoxicillin to them, and their pain start to reduce. So by the time I see them on Monday, they say I start to feel better after the antibiotics. So, in a way, I know it's controversial, and we don't want to over prescribe anything. However, if there is a chance that patient could actually get hold of something and they have a chance to start to feeling better, I'm not opposed to it. But on the other hand, if there's a tooth that sometimes on the phone, I never met the patient, but the doctor want kind of get some idea if they should prescribe antibiotics. And I said, does the patient still feel hot and cold? And I said, no, hot and cold doesn't matter, but if I touch it, it's like send me off the roof. When that happens, please give them some antibiotics. They're gonna start get significant relief. And if I do retreatment, no exception, I always put them on antibiotics even prior to getting the work started, because I'm gonna stir up. I just tell them, I say, I'm gonna stir up some old, resistant bacteria here. And
go ahead.
Yeah, and the other thing is, especially I guess in the endo practice, I deal with a lot of older patients. They may not be healthy in other, they may have some heart problem, hip and joint problems, or diabetes, blood pressure. Their immune system may not be as strong as we think they can be.
And then, of course, the other question is pain medication. Some people, what is your standard protocol for after a molar root canal pain medication? Do you
Okay. Most of the time, I just have them. I prefer for them to take Advil or Motrin prior to the numbness wear off, because once that wears off, that pain sets off. We have our neurons have pain memory, so it's going to be hard to stop a pain. Why not prevent that pain? So I always recommend them. And sometimes if it's upper root canal and I have a feeling the patient already. Oh, another thing is the pain they had prior had to do with their pain afterwards. So if I have a feeling the patient's going to have quite a bit of pain afterwards, I even give them Advil Motrin before they leave the chair.
Okay, and I is there any, it's what you take out, it's what you clean out, it's what you kill with the bleach. Is there anything as far as obturation that's better? I mean, is obturation? I hear some common complaints from endodontists that general dentists use too much sealer. You hear general dentists and endodontist. One of my best friends who was the endodontist who died, Joey D, Joe Dovkin. He liked warm gutta perchin pluggers to get that three-dimensional. Some people are big into single cone. Some are lateral condensation. Some like a carrier, like some of these obturators, single carriers like a thermofill. Does any sealer, do you think, work better? Any obturation system work better? Any thoughts on that?
Well, good question. I know there's calcium hydroxide based, and then I sometimes use AH plus. But overall, my biggest concern about obturation, excuse me, is I have a very gentle hand, and I hope when you obturate, use no matter what technique, don't think pushing on the side or pushing down so you can get that perfect look or perfect get a gutta percha to its place is the best thing, because especially with these days, a lot of teeth, by the time they need root canal, there's a chance, especially people older than 30, especially 40, their teeth got micro fractures here and there, crack lines there. I have seen so many root canal fail because of a root fracture. Furcation area, especially lower molar. If you look at those root, after the preparation, you possibly less than a millimeter. You have a very short distance from the PDL.
So that sounds like you're a pulp lover. You like to keep the sealer and the gutta percha away from the exit, as opposed to an apical barbarian who always likes to see a puff of sealer cleaned out the apex.
Oh, I don't care.
Are you a pulp lover or an apical barbarian?
Pulp lover.
Pulp lover.
And here's the thing: if it's a vital pulp, a lot of times you are not going to see that puff. Necrotic pulp, you're going to see that puff because by the time you work on it, there is some level of root resorption. So it's easier to see that puff. But I never care for the look. Of course, we get to the end, but no, to me, over instrumentation actually, especially if you go over that PDL, violate that natural area, it's actually worse.
Okay, you're so amazing. And you started in Beijing, you ended up in Texas and Baylor, Dennis, the PhD. You also jumped on a new technology, podcasting. You have a website called ReLaunch Show. Your husband that you married was in radio, and then you guys started. Tell us that story, and how's that part of your life? And tell us what you're doing there. What made you get into that, and tell us all about it.
Yeah, that's a very interesting story. We married for 14 years. He was a banker, and obviously I was a dental student. So later on, he
You've been married 14 years?
14 years. Yep.
Good for you.
Thank you. And so he left corporate maybe about 8 years ago, and he started developing his own coaching, speaking business, and become an author, had a #1 book on Amazon. And I started.
By the way, my book just hit #1 on Amazon 2 days ago.
Yay!
Under the category dental consultant, it is #1.
What's the title?
Uncomplicate business. You only manage 3 things: people, time, and money. And under dental business, it's #1. Sorry to interrupt you, but your husband's a coach or speaker, author on Amazon. But who does he consult with? What vertical? Any small business, or is he specific to?
Mainly, actually, a direct customer. So it's not business owners. It's people who actually want to reinvent their lives, want to find out what's true for them. So his customer mainly actually 40 to 50-year-old female who want to release their creativity in a different way than they've been trained. And he has a counseling and psychology background. So
is he a psychologist?
No, not a psychologist. So what's interesting is as he was developing his business, I find out there's certain things that I'm really good at, like internet marketing, social media. I'm real quick at learning lots of internet tricks. So not just tricks, it's just, it's something, SEO, all these things you have to do when you have your presence online. And I was just doing it, a couple hours a week for fun, and then help him launch his book on Amazon. And the more I'm involved, the more I'm intrigued with what he does. And then after a while, I was like, gosh, my practice is great, but it started to get boring. And I wonder what else I can do. And especially after hearing him coaching his client, finding what they can do. So he kind of guided me, and long story short, we start working together, and we actually help other people become #1 authors and to build a platform with their book or podcast. So that's
then help me.
You're doing an awesome job. You're very entertaining. You're a great interviewer. You already got your book.
Oh, you're just saying that because I look like Brad Pitt. Here's my mission. There's 2 million dentists on Earth, and Dentaltown only has 200,000. I still haven't found 90% of the dentists. And when I go to Tanzania, Ethiopia, I go to so many, Nepal, India, when these people discover Dentaltown, that's been out since 1998, has 4 million posts from 200,000 dentists with 350 online courses. They tell me it was like they died and went to heaven and figured out how to do root canals, crowns, implants. and that their stress went down and they started doing dentistry better, faster, easier, lower cost. When
Awesome.
I've walked into a dozen dental schools that when the dean sees me, literally bust out bawling, telling me that before Dental Town, it was all these 10, 20-year-old books. And then they discovered Dental Town, and now they don't need any of these foreign books that weren't native to their language anyway. And the
Oh,
cases on Dental Town were posted yesterday, whereas the books they used to have were 10-year-old books that took 5 years. So my mission is to connect all the world's dentists so they all practice better, faster, easier, lower costs. And I am shocked that 90% of the dentists on earth have never found or stumbled across Dental Town on a Google search.
mm,
I mean,
okay.
in fact, when you tell me we only have 200,000 dentists, I always think, we must be doing something on purpose to prevent our growth. Like how many dentists are in China? Because you said earlier that they all could read, which means they could all go to Dental Town and read. How many dentists do you think are in China?
Oh, gosh, I honestly don't know. Back when I was studying, there were only 30 or so dental schools. Now there are about 80, and that is by no means can meet the demands in the future. But here, internet marketing, when you look at the platforms, it's interesting because for them to access American site, it might be a lot slower. So there's a thing I think called the CD. What's that called? There's a certain license your host server might provide to so other people can actually, if people from different part of the world can access your site a lot faster.
Can you email me the information on that or Howard at
Yeah, if
dentaltown.com?
I'm pretty sure I can.
So, or do
So
it, go ahead.
go ahead, go ahead. We have that, and just so because if it loads slow, people will give up.
Right.
Yeah.
Right. That's why, yeah. So do any of my listeners, could any of them benefit from what you and your husband are doing? Has your husband ever consulted with dentists that are, you said mostly females between 40 and 50, trying to explore their gifts outside of dentistry? Has he targeted any of dentists for this?
Not particular. A lot of professionals, but no, that's not. He didn't really narrow down to the just that one profession.
Do you think he'd be an
But
interesting podcast for an hour, or do you think he'd want to make an online course on Dental Town?
it, I'm pretty sure he would. I mean, he helped me.
Because we put up 350 courses on Dental Town, and they've been viewed over 550,000 times.
Wow.
Because it's so, and that's what another thing I wanted to ask you specifically. You're in Baylor, right? Baylor, Texas. Is that the city you're in? No,
Dallas.
you're in Dallas, Fort Worth, and which is
Uh-huh.
interesting because you live in Dallas, but you're an Arizona Cardinals football fan, and you hate the Dallas Cowboys. Is that correct?
Whatever you say.
That
You're
is
the
correct.
host.
That is correct because if she says anything else, I'm going to cut her mic. If some young woman is 25 years old and she's getting beat up by endo and she said, "Can I come watch you for a day?" Would you let her?
Yes.
And see, that's the difference between street smart and dumb. I am always meeting these dentists and they have all this student loan debt, housing debt, stay-at-home wife, 3 kids, and they want to learn something. And they always feel like they have to fly across the United States, pay $5,000 for a weekend course, and go listen to some Nike, Adidas, Puma course. And I think the street smart people are the ones that get on YouTube, go on Dental Town, or just walk across the street to their endodontist. Like, if I want to learn the greatest endo in the world, I just call an endodontist on the street, Brad Gettleman, and say, "Brad, can I just sit and watch you?" And he's always like, "Sure, absolutely." I mean, street smart people can learn all the secrets of dentistry free on a Howard podcast. $18 for a 1 hour course online. For free, walking across the street to an endodontist, periodontist, pedodontist. Good luck with the orthodontist. I don't think any of them want to share their secrets. But I just don't think you need to spend $4,000 to go to a weekend course to learn endo. Do you?
Well, I do think a lot of dental schools, the number of root canals you done by the time you graduate is not even close to getting you sufficiently educated for that. But the continuing education is important. But also, if there's any way you can actually get hold of some extracted teeth and start practice, practice make perfect.
How many of your husband's teeth did he let you practice a root canal on while you were trying to learn how to do endo?
Oh, he has perfect teeth. I myself had 5 root canals.
So, and do you think that's diet or genetics?
Oh, it's my poor dental hygiene when I was a teenager. I, just ignored and get away from doing the things I was supposed to do
And
and
do you
paying
think
the
that
price now.
And do you think that was from you, or do you think that was the culture of the time and place of where you lived at the time? I mean, is that how
I have
everybody did it, or was that just you?
I have a sweet tooth. My sister has perfect teeth, so I can't blame on the culture. Not yet, at least.
And my last question, because we're out of time. By the way, when I had breakfast with the president of the Chinese Dental Association last year, he told me that he said there were 150,000 dentists in China, which is amazing because they have 1,300,000,000 people. The United States just has 330 million people, and we have 150,000 dentists, 120,000 general dentists, 30,000 specialists. So it was interesting how China and the United States had the same number of dentists at 150,000. Yet we were 300 million. They're 1,300,000,000. So what is it? 4-to-1 population for China and the United States? Is it 4-to-1 or 5-to-1?
Uh, well, depend on, I guess, what's the population now? I would say somewhere around that.
Yeah. And so
Yeah,
I thought that was very interesting. But I got to ask you one question before I go. How come every time I go to China, I can't find any Chinese food?
because they call them food.
It's so funny. Everything an American thinks is Chinese food, you pretty much can't find in China. Would you say that's true or false?
Very Americanized, yes.
Okay, well, hey, I'm your biggest fan. Is there anything should my viewers go to your relaunchshow.com? Your website is relaunchshow.com, ReLaunchShow.com. Do you think a
Yes.
lot of these dentists would be interested in that? Do you think any of my listeners would want to log on to you and start a podcast or talk about that? Is that
Um, exploring your gift, your creativity, to me is very important. And if you feel like there's something else out there, that there's something more you want to explore, sure, let's tune into our free podcast and hear how other people have made some life transition, either dramatic or not dramatic. And for me personally, I'm actually hopefully soon start a dentist podcast called the Dentist Happy Hour.
awesome?
Yeah,
Well, let me tell you, if you got a podcast, when I started Dental Town, it wasn't howardfarran.com. It was Dental Town. It was about a community. And one of the reasons I started my podcast was Dental Town has a podcasting section. So we have an app. And
yeah,
the other podcasters didn't want to put it on my deal because they thought, I wouldn't want that. I was like, are you kidding me? I mean, Dental Town has 4 million posts. I've only posted 20,000. I'm not even 0.001% of the posts. And when those dental podcasters put their podcast on Dental Town, and it was on the app, that was the best free marketing they ever did. Even though most people just got to listen to it on Dental Town like once, and then download on iTunes because that's how they listen to their podcast. But when
yeah.
you come out with the Dental Happy Hour, upload it on Dental Town, and so because we got 205,000 members on the website, about 40,000 of them have downloaded the app, and it's your best marketing. They all see it. And I can't believe that dentists put their podcast for free on iTunes and they don't put it for free on Dental Town. It's the best target marketing you can do. It's free. There's a dozen podcasts now. If you download the Dental Town app and go to the podcast section, there's a dozen podcasts on there. And every one of those guys who put their podcast on Dental Town said their downloads and views exploded. So when you come out with Dental Happy Hour, please put on there. I don't want to Dentaltown's about the dentist, and it's not about me or my column or my post, or it's not the
I
Howard
feel
Farran
the
show.
same way about
Uh,
mine.
yeah, and
Hmm.
the founder of McDonald's, Ray Kroc, is dead, and 40,000 McDonald's get up every day. Sam Walton's dead. They open up 40 new Walmarts today. Hell, I'm 53 years old. I'm not going to be podcasting for the next 10 years or 20 years or 30 years. Basically, and plus, you should start a dental podcast show, because if you can't create a dental podcast show better than mine, you're not even trying. Because I know I'm not even trying. Okay, so hey, Dr. Pei, you're just a hell of a person. Love you to death. And if you want to see what she's doing on her relaunch show, because you can help them start a podcast, right?
Definitely.
So if you go to www.relaunchshow.com and tell her that Howard sent you, she'll actually do everything for free. Is that right?
Yes.
Is that what you said? I'm pretty sure
Howard
she said that.
equals, yes, the
Oh,
ticket.
okay. Well, hey, and tell your husband if what he does in his consulting and what he does, if he wants to come on the show for an hour, I'd love to have him. Or if you or him or think it's better to build a structural, more professional our online CE course on Dental Town, you can do that. Do whatever you want. Dr. Pei, I'm your biggest friend. And thank you so much for sharing an hour with me today.
It's been an honor, and I cannot believe how easy it is to talk to you. And I hope we continue to keep in touch and work for the dentists, for their happiness, for their profitability, and yeah.
Okay. On that note, thank you so much.
Same here. Take care.